Good morning, my angels. I hope you are all doing well. I am Juan Torres-Falcon, and this is In Just 1 Minute. Do they look even? Oh my God, people are gonna see I'm wearing like athletic shorts on the bottom. We're going long today, people, because I have a lot to say, you have a lot to learn. So go poop, plug in your phone, and open up La Croix. Here we go. Part 2 of the healthcare breakdown. Premiums versus deductibles. The premium is the monthly payment for your health insurance, what you pay out of pocket every month. Your deductible is the amount you have to pay out of pocket for your medical insurance to take effect. If you have a $200 deductible, wouldn't that be nice? And you have already paid your first premium, you have to pay $200 out of pocket before your insurance starts to pick up the rest of the tab. You feel me? Let's talk high-risk pools. Get all ideas of Marco Polo out of your mind because this is one of Christina Machado's famous pool parties you don't want to be invited to. High-risk pools are a way to lower the healthcare costs of healthy people by removing narrow groups of people with pre-existing conditions that aren't eligible for Medicaid because they have more monies, asking them to pay more because of their health gags. Dems think they're unfair, and Obamacare eliminated the need for high-risk pools because it inherently promised coverage to all people, regardless of pre-existing conditions. The GOP healthcare bill is hoping to reinstate them and hand oversight of the governmental funding that helps alleviate the patient costs for pool members back to the states. Let's jump back from President Johnson and move forward to President Clinton. Picture it, 1993, Washington, D.C., Hillary Clinton giving a feathered chin-length blonde moment in a rich teal, prominent-shouldered power suit, taking on healthcare for the first time. President Clinton made reforming healthcare his business and was hoping his first lady would handle it. The Clinton plan hoped to provide healthcare for all by requiring all employers to provide insurance, but the small business lobby said, no ma'am, that's too expensive, bro. There is so much more to the failure of Clinton care, but I don't have the oxygen in the room to get it all out, so I'm going to post a New York Times article from 1994 in the description that will really illumine why it failed so miserably. Just know that healthcare reform has been at the forefront of the American brain since the early 90s. That's what matters. Personally, from my reading, it seems that the financial boom of the mid-90s greatly contributed to healthcare's movement from the front burner to the back burner. When you have the internet, who needs doctors? So let's just blame AOL and Al Gore and move on. Romney care. Oh yes, there is such a thing. Mitt Romney was the Republican governor of Massachusetts in 2006, and with the help of Senator Ted Kennedy, a Democrat, this would seemingly be the last group project presented by Republicans and Democrats, Romney decided to get his state health insurance. Literally, actually, wholly, and entirely, it's Obamacare. Everyone was required to buy it. If you couldn't afford it, the state government helped pay for it. The whole gag. Even down to buying insurance on the healthcare exchanges if you don't have insurance through your job, parent, or spouse. The idea was created by a Republican, which is why it's so fierce to me that a Republican Congress would want to completely dismantle the same model. President Obama takes the White House and says that everyone should have insurance and you shouldn't have to pay more if you have pre-existing conditions. We're going to help the poor and expand Medicaid bigly. Here is the problem with Obamacare. It depends on everyone having health care, especially young, healthy people, in order to help pay for the overall cost for the poor and those with pre-existing conditions. But the penalty for not signing up is not severe enough, so healthy people just opt out and then we don't have the money to help lower and cover the cost of the poor and those with pre-existing conditions. You feel me? But so many people were able to sleep at night because they finally had insurance. From day one, Republicans were not feeling Obamacare. They have been calling to repeal and replace Ms. Obamacare for her entire life. The new GOP healthcare replacement bill, Trump care, Ryan care, Better care, whatever you want to call it, removes the insurance mandate from everybody, slowly pulls back the Medicaid expansion over the next 10 years, and don't let anyone tell you otherwise, lowers the taxes that were put in place to cover the costs, and hopes to reduce premiums. This GOP healthcare bill matters so much because they had a lot of time to put their money in their mouth hole. They have the control of Congress and the White House. So what's the problem? Well, it's just not that easy to dream up a new plan and put it in motion quickly to make good on the president's campaign promises and ensure that all people that currently have insurance continue to have access to it. Majority Leader Senator Mitch McConnell is holding the GOP to their promise of a full repeal and replace. But many Republican states took advantage of the Medicaid expansion and don't want to let go. Enough Republicans are tentative, so they just don't have the votes. And Democrats can call the Republican bluff by saying they want to work on a bipartisan bill, knowing full well that the Republicans can't do that because it won't look good. But the Dems aren't in the clear either, because Obamacare has a lot of problems. And if Obamacare fails entirely in this awkward meantime, it will prove the Republicans were partially right, even if the failure is due to political inaction. You feel me? Are you with me? The GOP bill would also decrease our national deficit by over $300 billion. And that's a good thing. That was a lot. Thank you for joining me on this extra special long Juan Minute. This was definitely a Juan Minute, a Cuban Minute, very different, longer. Share your thoughts with me in the comments, and please let me know if you have any questions. If I don't know the answer, I will find it. I have spent hours and hours reading about this because I'm very passionate about it, and will continue to do so to answer any of your questions. Congress is back on July 8th, so let's see what all these messy queens have in store for us. I love you all dearly, know that. Please bring a smile to someone by having one yourself. I'll see you Monday.